my end goal is that I want to do disaster relief work. I want to retire early at like 50, 55 and do disaster relief work. And that's why I do my business, though, is so that I have this disposable income so that if I want to do a volunteer-based work, I can.
Yes.
I
Talking
can
about
fund
your
that.
business, can you talk to us about your cosmetic injection business? And what's the name of it?
Aderma.
Yeah.
So it's cosmetic injections. I do neuromodulators, also known as Botox or Dysport, and I do filler treatments like hyaluronic acid fillers.
Oh my God.
Yes, and that's like my own business entity. That's my own baby. But again, like all of this is the end goal so that I want to retire early and do disaster relief work.
Straight facts. Back at it again. You already know. So, Son the Cut.
Habish Manny in the house there.
And today we have Annie, a registered nurse that works at the emergency room for the Ottawa Hospital. Thank you so much for coming.
Thank you for having me. It's a
Thank
pleasure.
you. How you doing?
Good, thank you.
That's good. Can you start off by telling us a little bit about yourself, Annie?
Like you guys said, I'm a registered nurse.
Right.
I have been practicing for about 10 years now. Graduated from the University of Ottawa in 2013. Currently work in the Civic emergency department. So I specialize in emergency nursing. However, I also do circulating recovery nursing for a cosmetic eye surgeon. He does ocular plastics. And then I also run my own cosmetic injectable practice.
Oh my God, that sounds like a lot here.
So you're doing a lot of work then.
Yeah.
So how did you start to pursue that type of career in general? How did you get into nursing?
That's a really good question. So I actually didn't know what I wanted to do until the 12th grade of high school. I thought I wanted to be in psychology because I knew I always wanted to help people. However, after doing a few psychology courses, I realized I wanted to get like more hands-on, I guess.
A hands-on experience.
And it was one of those things where I realized I was always taking care of my friends. Like if people got wasted and threw up, I'd be like, oh God, we have to clean up this house now. Right. Wouldn't even bat an eyelash. I was the one cleaning up after them. So then I realized, oh wait, maybe I should go into nursing because I really love anatomy, physiology, things about the body, science. And why not do that and help people as well? Yeah.
So it benefits you overall.
Sure. So what program exactly that you took in Ottawa? You there?
So the University of Ottawa is actually the only university in Ottawa that offers a nursing program.
Okay.
Yeah. Carleton doesn't have health. I don't think they have health sciences. Well, at the time they didn't.
What about Algonquin there? I thought they did the RPN program that's switching.
Yeah, so they have the RPN program, and Algonquin also has a collaborative program with the University of Ottawa for your bachelor's degree.
Okay.
So even though it is done through Algonquin, you're doing all your clinical placements with Algonquin.
Okay.
However, you are getting a bachelor's degree in nursing sciences, and it's through the University of Ottawa. They just Algonquin, they schedule all of your clinical placements, and all your lab studies are done at Algonquin. So it's the same degree.
Oh, nice.
Through the University of Ottawa, but then it kind of splits up, like doing your lab and your clinical practice is scheduled through Algonquin versus being scheduled through the University of Ottawa.
It's like a partnership, basically.
Yeah, exactly. A collaborative program.
Nice.
With that being said, what would you say would be the biggest challenge that you find transitioning from, a student that is doing their placement and getting all that experience to actually working in a professional environment setting,
That's actually a really good question. So I think a lot of people who go into nursing studies don't realize how much of it is actually hands-on studies. You do all of it. You do all of the like actual learning, the textbook learning, the academic portion of it,
right?
And then you do the placement,
right?
So it's really sometimes there's like a disconnect, because you're doing the academic portion and you're like, why am I learning this? And then you're doing the clinical placement,
right?
And you're like, okay, this is exactly why I'm learning this, and it makes sense, but you don't actually connect it until you're practicing it over and over again, like. I've learned so much more just from actually being a practicing nurse versus what I did in schooling.
Overall.
Just my 1 year of even working in the emergency department.
That's true.
And my emergency department, experience didn't start until 3.5 years ago. And so I'm still learning. After 6.5 years of nursing, I was still learning things I didn't know.
It's still a new challenge.
So I'm constantly learning. But it's like so hard to transition from schooling to actual practicum and
Day
like
to day.
practicing and working, because there's such a huge, you have to practice it.
Yeah,
And the
Right.
more you practice it, the better you get at it and the more you understand the concept.
Yeah,
That's true.
it's just
Yeah.
it really clicks in the more experience that you actually have and
Yeah.
the more that you actually do it with repetition. You know what? Speaking of which, do you mind sharing your experience with just working in the emergency room overall in general?
Mhm.
Like you mentioned that you've been working at it, you know, and you're gaining experience within the past 3.5 years or whatnot. How was your experience overall?
So I think we have to actually break down what the emergency department is like,
Yeah.
Mhm.
because it's not just one area. You think of the hospital and you
Mhm.
think of like the different floors. You have the
Right.
surgical floors, you have the medical floors. The emergency department actually has 4 different areas if you don't include triaging.
Yeah.
Okay.
And triaging is like your boss level. Like
Mhm.
once you get signed off on triaging, you can work the entire emergency department.
Yeah.
Oh, nice.
But the 4 different areas of the emergency department are your urgent care.
Mhm.
So that's more like a clinic-based setting, like your
Mhm.
walk-in clinics. You and I would go there. We call us
Yeah.
the walkie-talkies,
Yeah.
right? We know what's wrong. We can walk around.
Yeah.
We can talk to people and tell them what's wrong.
Yeah.
Then you have your observation area.
Right.
That is more like your medical surgical floors, kind of like glorified nursing homes.
Yeah.
Like the individuals who have a lot more comorbidities, like they have all the diseases,
Yeah.
Right.
and they're not as mobile. Obviously, they can't walk to the urgent care.
Yeah.
They are more complicated, but when they get sick, it's really easy to like, oh, okay, we can just not like
Right.
necessarily fix you.
Yeah.
And
Right.
you don't have cardiac monitors there. That's when you just need a little bit more observing
Yeah.
That's it. Yeah.
than the clinic setting. And then you have emergent, which
Mhm.
is your first cardiac monitored area.
Okay.
Mm.
That's when, like, if you came in with chest pain and you actually
Yeah.
had a high heart rate, we'd be like, okay, you're young. You shouldn't be having
Yeah.
chest
We
pain
really
Right.
have to
and a
observe.
high heart rate. We really have
Yeah.
to observe you and put you on a cardiac monitor.
Yeah.
And then you have the resuscitation
It's just-
department.
Correct.
Yeah.
And resuscitation is the highest level of care where you get your strokes, you get your heart attacks, you get your traumas, your
Traumas, right.
motor vehicle accidents. And so those are the 4 areas that you can work. That's not triaging. And then triaging is actually you're the sorting hat.
Mm.
You come in, I look at you. I have 5 minutes to do my assessment to decide
Where to put you?
where to put you.
Oh, man.
Do you like triage?
I only recently got triage trained at the
No
end.
way.
I just finished my training at the end of June.
Congratulations.
Thank you. But I lost it. It's really scary.
For real?
Yeah, because I have to decide how sick you are in 5
Yeah,
minutes.
yeah.
Like,
You
can
have
you
to make a
imagine that?
Right.
whole
I look at you and I'm like,
assessment.
hey, you don't look that sick. But then what
And
if
then
you
the
are
funny
that
thing is,
sick?
they always ask me like from 1 to 10, how sick are you? Like, how was the level of pain? I'm like, fuck, I'm 15. I'm just trying, you know. I just want to see a doctor, you know what I mean? I'm always going to take 15. They say 1, 2. Reason why I'm here. Well,
I didn't give you 15. I gave you 1 to 10, man. Choose a number. Skill is like usually pain.
right.
Yeah.
Yeah, and we're trying to assess your level of pain because it matters where you're being triaged to. But I will say being triaged trained is really scary. But now it's nice to be able to work like all of the emergency department,
Yeah.
right? But I'm still like just the end of June I got signed off.
Mm.
So I'm still like, hey, like what do I put for this? I'm
Learning
still checking my
experience.
work all the
Yeah.
time.
Yeah.
I take a little bit longer to do my
But that's okay.
triaging.
Yeah.
And I'm just like so nervous because if you have a waiting room full of
Right.
people, as the triage nurse in front triage, you're responsible for all of those people who haven't been triaged yet.
For real.
Sometimes you have a waiting room full of 30 people.
Yeah.
How am I responsible for 30 people who haven't even seen a healthcare professional yet?
Yeah.
I just have to watch on top of triaging.
Yeah. It's
So it is really
observation.
scary.
You know what? It literally ties into our next question, which is, you know, what are some of the skills that you find that you need to be
Yeah.
a good nurse and to, you know, complete a triage assessment overall? Because it's, as you mentioned, 30 people in one room. You're the one responsible for it.
So, like, basically, do you need like any personality and traits do you think are important to be a nurse?
I think there are so many, like we come in all shapes and sizes, right? And there are some people who are more fit to be a nurse than others in terms of like their personality.
Okay.
I think really knowing who you are
Mhm.
is really important because you have to be able to let a lot of things slide off of you. Like you can't take anything personally. Some of these people are having the worst days of their lives,
Right,
right?
yeah.
Like of course they're going to treat you terribly. They don't even know how to
Mhm.
act themselves. They feel horrible.
Mhm.
But I think being stern,
Mhm.
assertive,
Mhm.
demanding respect when you're being disrespected is very
Right.
important because you're also human. You're only
Mhm.
trying to do your job and help someone, and people forget that, right?
I feel that there's a lot of nurses that's very smart, with like a good average, 95% average. But when it comes to the day-to-day stuff and it's just like common sense and stuff, and when personality wise, they're very they don't really get along with the patient that much. If you know what what I mean there.
Like their personal skills
But
are
yeah,
a
the
little bit
person,
lacking.
yeah, that's it. Yeah.
Yeah. And I will say that comes with time as well, right? That comes
Okay.
with experience.
Yes.
Knowing how sick someone is, knowing how to interact with someone comes with experience.
Right.
I can remember when I first started nursing, I used to bend over backwards for everyone to the point of being manipulated. Patients
Yes.
will manipulate you.
Mhm.
And you don't realize it because you don't know any better.
Yeah.
So I used to be manipulated
Right.
into just like bending over backwards for everyone, like did everything for them until I realized like these people don't respect me.
Mm-mm.
And respect's a two-way road, right?
Yeah.
Like you have to understand like I will do these
Yeah.
things for you when you actually speak to me in a more respectful tone. But that
Yeah.
came with time. It took me a good 5 years before I was able to be more assertive
Right.
and actually demand respect for what I was
Right.
doing. I wasn't like that at the
So
beginning.
how do you deal with a patient that keep asking for like help, I need a sandwich, I need a drink, I need this, I need that? Like after a while,
Yeah.
like we work together. I'm a porter, right? So sometimes I just walk by and I see the patient that needs help and stuff. So to me, I'm just like, obviously, I'm gonna come up to the nurse and be like, okay, maybe he didn't get any help. But when I do and talk to the nurse, they're like, no, just don't worry about it. we've been talking to him the whole time, right? So how would you even deal with a patient that keeps asking for help constantly and say, hey, I need help, I need help?
Well, so that's all situational based too, right?
Mhm.
You have a confused patient who doesn't realize they've already asked for help.
Right.
Maybe you've already met those needs. So what are you going to do in that sense? You are kind of have to ignore them because
Okay.
you've already done what you needed to do with them.
Right.
Like you check if they're wet, you check if they're hungry, do they need to drink something?
Right.
You've done all of those things, and then
Right.
you get the snippet of like the 5 seconds that you're walking by and someone's calling for help.
True.
That's a confused patient though, that's got like dementia.
Mhm.
They don't know where they are. They're in an environment that they don't understand, that's unfamiliar to them. It's very understandable that they're going to be asking for help all the time. In those cases, you're assessing like, oh, well, they're not climbing out of bed, so they're not imminently going to hurt themselves. So I don't necessarily need to help them right now.
Yeah.
So it's prioritizing the help. Then there are people who are screaming in pain,
Mhm.
and that's the kind of help that they need, and they need pain medications.
Right.
By all means, that's when it's totally appropriate. Maybe they're busy in a room, like they just received a new patient, right? And usually the ones who are at their most distress and in their most pain are usually the new patients where we haven't actually addressed those issues yet.
Yeah.
And when we have medical directives in the emergency department where you're allowed to start very simple, like over-the-counter medications like Advil and Tylenol. But if you're having a 15 on 10 pain, as you would say, and Tylenol is just not going to cut it.
Yeah.
But when you need narcotics, you have to communicate that with the physician.
Mhm.
So I have to talk to a physician before I can even give you
have to get
narcotics,
approval
right?
first, yeah.
So again, you're getting that
Yeah.
5-second snippet of someone screaming in pain, but maybe the nurse is actually going to look for the doctor and is
Yeah.
already like, oh yeah, I'm already getting their pain medications.
Yeah.
Right? Obviously, I'm not going to say I don't get annoyed by the
Yeah.
ones who are like, I want a sandwich, I want a sandwich, I want.
Mhm.
Oh, well, you've already had 3 sandwiches. Can we share the sandwiches with the rest
Right.
of the patients
Yeah,
in this emergency department?
I got a question for you, Annie. So let's just, if you're dealing with a situation and yourself became sick, right? Would you go to the Civic hospital for to take care of? That's a solid question right there.
Yeah.
So let's be honest, right? I don't live too far from the hospital, and there's days where I got sick, and I told myself, do I really want to go to work? Or should I just go all the way down to Queensway?
Yeah, just like, hey, they don't
for
know
them
me
to
here.
see me. Sometimes you just want your own privacy, right?
I do think about that sometimes.
Yeah.
And
I think we all do as an employee, right?
I think it's situational,
Yeah.
right? So my family doctor, the office closed at 7. If I have to work tomorrow and all of a sudden I'm like, oh my God, I think I have a urinary tract infection.
Oh.
I'm sick for a urinary tract infection. Like that's a whole shift, a whole 12-hour shift just so I can get antibiotics for a urinary tract infection.
Correct.
I would go there knowing that my colleagues are there.
Right.
And I'd be like, hey, I have to work tomorrow, but I need to get antibiotics so I'm not peeing every 2 seconds so I can do my job. Then I would go there. But if all of a sudden I'm like bleeding profusely
That's
from
a whole
like my lady parts,
yeah.
then I'd be like, do I want one of the doctors that I work with to check me out down there?
Yeah, that's the thing.
Situation based. At what
Smart.
point, how private do I want to be?
Yeah,
right? Is it something that I imminently need help with? And do I want the doctors to see that part of me?
Yeah.
Okay.
Simple things.
'Cause
Antibiotics
yeah.
for a UTI because I get to pee in a cup and give you a cup and you can say, yeah, you have a UTI.
Yeah.
Or like you're bleeding down there. How bad is it? I have to look in there.
Yeah, and it's like, okay.
And you're like, well, I don't want you to look at my sex organs because I work with you.
Correct.
So
It makes
I
sense.
see. I
Makes
see.
sense.
you got to
Makes
assess
sense.
the situation.
Yeah.
Okay. I'll take that a note there for the next
Yeah,
time
no,
I
that's
have an
smart.
issue there.
It's smart. It's good thinking. It's critical thinking, right? So it makes
Exactly.
sense. It makes sense.
Literally my entire profession is critical thinking.
It is.
Um, Speaking of which, what do you like the most about your profession?
Hmm.
I always feel very accomplished at the end of the day. I feel a sense of accomplishment, and like I'm doing good for the world, even if it's just for the little city of Ottawa,
Mm-hmm.
right? And not a lot of people can say that they go home feeling accomplished at the end of the day.
Yeah.
Right.
And so that's what I love the most about my profession.
What would you say is, the achievement that you're most proud of in general?
As a nurse,
In general, it could
in
be as a
general,
nurse. It could be with, your business that you're also doing,
I
that you're
think
operating.
I really do just like wholly respect the profession, like the nursing
Itself.
profession.
Yeah.
So for me, one of my biggest accomplishments,
Mm.
probably also my mother's proudest moment, is that I graduated with a bachelor's degree in nursing science, and I thank you, and that I actually love what I do.
For sure.
Like I didn't do it because people were like, "Oh, you make a lot of money." I'm like, no.
Mm-mm.
If you're going into nursing profession because you think it makes a lot of money, you're in the wrong profession. Because let me tell you,
We're not gonna
based
go
on
there.
the
Right?
work that you do, you don't actually make that much money.
We're not gonna go
So
there.
for me, it was definitely doing something that I love.
Yeah.
It just so happens that it was nursing.
Yeah.
Yeah.
So we know in Emerge and whatnot, we deal with a lot of short staff, right? As you know. So tell me, how do you deal with that?
So I work on the premise that like I showed up.
Yeah.
I'm here, so
Mhm.
I'm going to worry about who's here right now, and we're
Right.
going to make do with the best of what we have
Correct.
instead of focusing on all the negative aspects of it,
Right.
which I will say a lot of I don't want to call out all the senior nurses, but when you get jaded and burnt out,
Mhm.
it's so hard to focus on the positive aspects of nursing.
Mhm.
Everyone has bad days. I have bad days as well.
Mhm.
But for me, I operate on the premise that I'm here,
Yeah.
Mhm.
you're here,
Right.
we're all here. So how are we going to make this work today?
Yeah.
Right.
Right? Because we're all here doing the best that we can with what we have.
Yeah.
Right.
We're working it one day at a time, right?
Exactly.
So
And so for
there's
me,
only
I
so
don't
much you can do.
like it is shitty.
Mhm.
I have work short staff.
Yeah.
Sometimes my ratios are off, but I'm here. I'm going to do what I can.
Correct.
And it's honestly, when you are short staff, you don't even have time to focus on what
Mhm.
you can't do. You're just so busy running around doing everything that you can do in that
Yeah,
moment.
it's just
Mhm.
delegating everything, right?
Exactly.
Making sure that we can cover as much work as possible with the amount of people that we have.
Exactly. I don't
Yeah.
even have time to think about
Yeah.
what how it's
Yeah.
burning me out.
Yeah. Speaking of which, again, how do you feel? Well, in that sense, how do you handle the stress outside of work? Because I would imagine, it's a stressful situation overall, and it's a hectic situation to be working on a daily basis. So how do you handle that outside of work?
So it might not seem like it, even though you guys don't know me that well yet. I seem quite extroverted,
Mhm.
but the way I recharge my battery,
Mhm.
I'm very introverted.
Mhm.
I
Mm.
recharge my battery by being alone.
Okay.
So I spend a
Okay.
lot of time alone, only because like my job is to be with people all the time.
Do you read books?
So it's
I do. I
Oh.
read books and I watch anime.
Oh.
I'm a little nerd.
okay. Okay.
I see.
That's how I recharge. I recharge alone by myself. Of course, I have time for like a social capacity for friends and all of that stuff, but I spend a surprising amount of time like alone recharging my battery.
Mhm.
I think a huge part of like how I cope with everything as well is that when I am at work, I put 100% of what I need to do. Like I put 100% of myself into work.
Yeah.
You know how like some jobs you can work at half cap and you can
Yeah.
get by.
Yeah.
I don't work at half capacity at my job ever.
Yeah.
And so it's really easy for me that if I'm always working at 100% capacity when I'm at work, that when I go home and I go and I think about all the things that I could have done, when I truly think about it, could you have done that, Annie? Because you were already doing everything that you could have done while you were there.
You don't burn out?
I do.
Okay.
I recognize my burnout though.
Okay.
I'm very good at recognizing my burnout.
Yeah.
But because I put 100% of myself while I'm at work, when I
Okay.
go home and have those thoughts, I go, wait a minute. When did you have time
Right.
to actually do those things? Because
Yeah.
charting is also part of our job. People see us sitting down and they're like, do your job. I'm like, you do realize legally I'm supposed to chart what I'm doing, right? Because if I don't chart what I'm doing, that doesn't exist in a court of law, right? I can still go to court.
Of course.
Right?
They can
But
always bring it up.
if you didn't write that down in your documentation, it didn't exist. You didn't do it. So charting is still a part of my job. So when people are like, get up, I'm like, no. If I didn't chart it, it didn't get done.
Yeah.
So that's a part of my scope of practice as well.
So people want to know actually, what's the biggest difference from pre-COVID and after COVID? Sorry.
Pre-COVID and after COVID.
Yeah.
So, okay.
Well, we're still in a COVID mode.
All the mask mandates. I think for me, I was expecting this because when we were actually in nursing school, they taught you about SARS. They talk to you about pandemics. They teach you about them.
Yeah.
Okay.
So when I was doing my degree, SARS was the last pandemic that had happened.
Right.
And there had been nothing else since. So I was already expecting this.
Yeah.
So in my mind, I was like, it's going to happen. When is it going to happen?
It's a matter of time.
And that's why I was like, it's going to happen within the next 10 years of my career. For sure. And so I knew it was happening.
Yeah.
Or it was going to happen.
Right.
How bad was it going to be? I didn't know, right? Like this is the first time a pandemic has gotten so far as that there was mask mandates and that countries were shutting down.
Yeah.
This is unheard of.
Yeah.
The pandemic that we finished was unprecedented. It was unheard of. No countries ever did that.
Curfews.
Yes, this is actually historical.
Yeah, it would be historical for sure. A lot of case study, I would imagine, would come out of this, right?
Well, yeah, because the vaccination came out so quickly.
And a lot of people, unfortunately, passed away because of this, too. You know what I mean? So.
And it's so complicated, right? Because everything is science-based and evidence-based practice, but you have a vaccination that came out within like a year. And a lot of risk assessment is the greater good than the individual good.
Yep.
That's what triaging is. Saving the most amount of people
in comparison
to like saving a smaller amount of people.
A smaller
right?
population.
And I get it. Like everyone is selfish to their own needs. But when you actually look at the greater good of things, that was the grand scheme of things, was that it was supposed to protect more people than it was supposed to cause harm to.
Yeah.
So for me, I was expecting.
But unfortunately, like, I actually had it once. And I just felt like it was like a normal cough to me, right?
Everyone's different, though.
Yeah, my body, I don't know. I didn't know if it was COVID or it was just a normal cough or what. I don't know. I got like 7 days out of it. I just stayed home. My supervisor said, "Oh, you gotta stay home." I said, "No problem. I'm staying home."
Yeah, but that's the thing about any, like, it's the same thing with drugs, vaccines, viruses, diseases. It's going to affect everyone differently because we're all different shapes, we're all different sizes, our immune systems are made differently, we have different genetics from an evolutionary perspective, just like how like Black people are at a higher risk of getting hypertension, Chinese people higher risk of getting hypertension and diabetes, and that's just a part of it, right? Like exactly. So you can't say how you're going to react from one thing to the other. It's going to be completely different.
It's a case by case scenario.
Exactly.
Everyone will react differently to.
Yeah, and it can go even as simply as like Tylenol. People are like, I don't like Tylenol. It does nothing for me. It gives me gut rot. It's like, oh, it's not supposed to do that. But for you specifically, it does that, unfortunately.
Do you have a type of patient where it's harder for you to deal with, basically? For yourself, personally?
I think people who are... I just don't deal well with being disrespected.
Okay.
Facts.
Right.
I think, but I've
so
learned.
Give us a story.
Yeah, I was just
give us a little story.
Have you ever had a scenario where you know what, you were having like a really impatient patient in general, and you're like, you had to handle it, but how did you handle it in that situation?
Okay, so there are many scenarios in which I've been disrespected.
Yes.
If we talk about my first time ever being disrespected and having like a racial slur called for me, I did not deal with that well.
Okay.
I felt myself go red and hot immediately.
Did you cry?
I did not cry.
Okay.
I did not cry.
Okay.
I did not cry, but I went like hot, confronted her. like repeated what she said. I was like, did you just say that? And then
What did she say?
she called me slanty eyes.
Okay.
Oh, wow.
It was the first time I ever had a racial slur.
Yeah.
This was like 4 years into my nursing
Yes.
profession. And then
Unexpected.
it was unexpected. And then the person I was working with was, I think he is Lebanese.
Okay.
So he was like, oh, Annie, is that your first racial slur? I get them all the time. And I was like, hey, but you work in the emergency department. Like, I only float down here.
Yeah.
It's my first time getting it.
Yeah.
And then
It just hit different.
it did hit different. I've never been more livid in my life.
Right.
And then when I was like, did you just call me slanty eyes? She went, I want to speak to a doctor. And so that cut me off immediately.
Right.
And I was just like, I can't deal with her right now anyways. So fine, like, you can wait to deal with the doctor. And I just like off put it. Now, if you're going to say something like that to me, I'm just going to walk away. I'll just be like, okay, when you want to speak to me in more respectful tone, I'm going to come back and help you. But until then, I'm not going to help you.
Right.
And it's really quick. It's so funny how quick people start to act properly.
Of course.
When you tell them you are not going to get help until you treat me with respect. And it's so simple.
We don't have time for that.
Yeah, we don't have time to deal with you. I hear you. Hey, thanks so much for sharing. It sounds like quite the experience, I would say. I was gonna ask in general, so what do you think is the most important thing that you need to work on to improve as a nurse in general? And not just yourself, just to improve the profession of nursing in general. What would be,
Yeah, good question.
Help out?
Good question.
Nursing is a profession where you never stop learning. So I think when you reach a point in your career where you feel like you haven't learned anything, you
need to reassess.
Yeah, you need to reassess the situation because that's impossible. Like I'm in my 10th year of nursing and I'm still learning to this day something new.
Right.
And so for me, I'm like, what do you mean? Like you've been doing it for 30 years. And the thing is, it's an ever evolving profession. Everything is based on best practice guidelines.
Yeah.
And guess what? Best practice guidelines change annually.
I would imagine.
It's all based on research. And so even just the newer generation of nurses that come into the profession now, I go, oh, why do you do it that way? And they're like, oh, this is what they teach us in nursing school.
Right.
And then I'm like, what?
Yeah, this is completely different.
This is not how I do it.
Yeah.
And then I have to go back and look, oh, they don't teach it that way anymore. Best practice guidelines state that you do it this way now.
In 10 years from now, do you still want to be a nurse?
Yes.
Yeah.
100%. Yes. I'm like, people always ask me if I want to choose a different profession. Even through the pandemic, this is my life's work.
Okay.
Whether it's, and the thing is, I think people think of nursing as such a small profession, but you have such a broad background of nursing. Like you don't just have to nurse in a hospital.
Right.
You don't just have to nurse in a nursing home. You can do community care nursing. There's safe injection nursing. You can be an educator. You can be a professor. You can be a clinical educator. Like there's so much that you can do with nursing. You can work in insurance claims if you want.
But it seems like
the grand scope of it. Like, there's a lot of opportunities.
And that's the thing when people are like, I don't like nursing. And I'm like, no, you don't currently like the nursing job you're doing. There's so much more that nursing has to offer.
It seems like the new generations of nursing, first of all, they're younger and younger, right? Especially when I work at the hospital. When I keep seeing the nurses, they're younger and younger now.
That's because we're getting older.
That's it could be as well.
I hate to tell you this,
but it seems there's also a lot of turnaround when it comes to the nursing, and people like keep just changing jobs and whatnot. Have you seen that yourself?
Like, are you referring to like a high turnover? Because there are a lot of people there.
High turnover.
Yeah.
So I will say, and a lot of the senior nurses will say the same that I currently work with, people do use the emergency department as a stepping stone to greater and better things, I guess. Because a lot of the other jobs that are a little more cushy, like if you're working in the cardiac cath lab, you need critical care experience. And critical care experience is either ICU or in the emergency department. And so if you want to work in like an endoscopy clinic or doing PACU, so post anesthesia care unit, you need critical care experience. Or labor and delivery, you need critical care experience.
What about the Heart Institute?
Heart Institute, you do have the inpatient nursing areas where you don't need the critical care experience. But then the like nicer 8-hour job, like 8-hour shift jobs, like in the cardiac cath lab, you need critical care experience first.
Would you work at the Heart Institute?
The Palace, they call it.
They call it the Palace?
They call it the Palace.
Oh, yeah.
It's known as the Palace. I would work in the cardiac cath lab,
Yeah.
probably towards the end of my profession. I don't know that yet though, because I believe in working in a place until I don't really like it that much.
Yeah.
Like I left inpatient medicine because I started not to like it anymore.
Yeah.
But I'm a firm believer of not working anywhere that you hate.
Yeah.
And that's the thing about burnout is a lot of these nurses that I'm currently working with fucking hate their jobs.
Yeah.
And I'm like, oh my
Yeah,
God,
that's
like
true.
you guys do realize there's other things beyond this. And it's really hard for people to change, right?
Yeah.
It's really scary to do new things and to change something that you've been doing for like 10, 20, 30 years.
That's true.
But the thing is you're miserable and you don't recognize it.
People get stuck in their ways.
Yes.
Yeah.
Sorry, what was the question again? I got so sidetracked.
No, hey,
we're
you
just
actually
talking
did.
about like, would you work like, for example, at the Heart Institute, or would you work even at the OR, for example?
So I don't really like OR nursing. I'm currently doing it like circulating recovery, but I do it. I call it my cushy job because I only do it's only once a month.
Yeah.
It's only once a month. It's a casual job, either 4 hours for a shift or 8 hours for a shift.
Okay.
And it is circulating recovery. I would never scrub in. It's not like a transferable skill for me. I don't want to learn to like pass instruments and do surgeries with surgeons. I'm just not interested in that. And like currently I'm still super interested in emergency medicine.
Yeah.
However, my end goal is that I want to do disaster relief work. I want to retire early at like 50, 55 and do disaster relief work.
I'm definitely not retiring at 55.
Yeah.
That's
and
interesting.
that's why I do my business though, is so that I have this disposable income so that if I want to do a volunteer based work,
You can
I can.
Talking about your business, can you talk to us about your cosmetic injection business and what's the name of it?
Aderma.
Yeah,
like my name, Annie Do, but derma like skin. I thought it was really clever.
It is.
Oh, wow.
So it's cosmetic injections. I do neuromodulators, also known as Botox or Dysport, and I do filler treatments like hyaluronic acid fillers.
Oh my God.
Yes, and that's like that's my own business entity. That's my own baby. But again, like all of this is the end goal so that I want to retire early and do disaster relief work.
How long you had this business for?
How long has it been operated?
I started the practice, I want to say 2018 and really got into it in 2019. Yeah.
Okay.
Yeah.
That's good. Did you ever see any horror stories overall in general?
Not personally. I personally haven't had any horror stories, but again, a lot of these jobs, like I work at in the emergency department and on a part-time basis. And then I do Aderma, my cosmetic injectables, on a part-time basis, and I work casually. So right now, I'm currently reprioritizing my life.
Yeah, a little triage.
Yes, a little triaging for myself because I have too many eggs in like many baskets and I need to streamline it because, I'm only getting older. So I'm 34 this year. So now I'm like, okay, how are you going to streamline it so that your business can be your disposable income so that you can retire early and do the disaster relief work? Because now I've met that triage training. I'm at the highest level of nursing that I can be in terms of emergency nursing and critical care. Exactly. The other thing is I meet a lot of interesting clients. So I have this one client who actually recommended to me, and I didn't even think about it, was to try some northern nursing first.
What is that?
Like nursing up north in northern communities where they have northern where they have limited resources. So I didn't even think about that until she was like, because you're going to do your first disaster relief contract and you're going to be so surprised by how little resources you have.
It's completely different.
And you're not going to know how to act. Because I work in a hospital. I have everything at
I
my
got a funny
disposal.
question for you. So do you have any patient at the hospital and then you just thought of your business and be like, oh, there's my card. Kind of thing.
I would imagine that would be unprofessional, but
never.
Never. Okay.
Absolutely never. Maybe like colleagues.
Yeah,
co-workers, colleagues.
Have you had any colleagues come into your business?
Yes.
And
we don't talk about that. That's private.
That's true. That's true. That's funny though.
I would never give my card to a patient.
Okay.
No.
I would imagine it'd be unprofessional.
It would be super unprofessional.
Go against the whole.
Yeah. I'm doing acute care right now. You're really sick. We're not going to talk about how I should fix your face. That's rude.
Not a good experience, I would imagine. Well, you know what? Last but not least, what advice would you give to a new aspiring nurse that's trying to get into the profession? So
Give it a little bit of time. Honestly, I think people are really hard on themselves, especially with the pandemic. A lot of the practicums, not were necessarily cut short, but a lot of it was online as well.
Right.
And then you did your practicum. So it was really hard transitioning from like this online based learning to like learning in person and actually having real life experience. People need to be a little softer on themselves and give themselves time, because you will get better at it. It takes practice. Right. And so I think a lot of people are leaving the profession before they even give themselves a chance. Right. And you have to understand, like, some of these people were in the profession for the wrong reasons in the first place. But the ones who were in it for the right reasons, like they did love this, like their mother was a nurse, their grandmother was a nurse. And so, and they absolutely love it. They took pride in it. Right. And then they just didn't give themselves enough time to like, you need more than a year. It took me 5 years before I was like, now I can communicate with people properly. Like, you know what I mean? And I'm still learning.
It's a skill.
5 years.
It was like 3 years to be comfortable, and then 5 years to really know that because you still second guess yourself in the first like 3 to 5 years when you're rather new at it, right? Because you're like, oh, I'm still learning, I'm still experiencing new things all the time, and that's going to affect your practice, right? So I found it took a good 5 years before I was really confident.
How was your first day of triage? Oh, that's what I know.
Oh,
that's a great question.
Yeah, I just want to know how
it was.
Yeah. We're nervous, or
we have really good colleagues.
Okay.
Like we have the emergency department that I work in at the Civic. We have really good colleagues. Everyone's very supportive.
Very nice.
So I felt very supported.
Okay.
Luckily, they don't leave you at front triage overnight by yourself until you get a few more months of experience.
A lot of people there, man.
Yeah. They give you ambulance triage, so you have all your resus nurses with you.
Okay, that's good.
So then you go, I was thinking of putting this person here. What do you think? And they're like, yeah, that's what I would do too.
Yeah.
So you get a lot of the not quite supervised supervision, because you can ask questions. Yeah.
And you have people that know.
Yeah.
Were you kind of second guessing yourself when you fulfilled on the first day?
Yes, I was. And that's the thing. That's exactly what I'm talking about when you ask about like what advice would you give nurses who are aspiring to be like, that are just getting into the profession. I'm still second guessing myself because I just learned a new skill.
Right.
I'm still second guessing myself. I'm still getting my work checked, and I've been nursing for 10 years.
Yes.
Have faith in the in the camaraderie and the fact that you're able to have good teammates and they're able to give you guidance, especially in that type of stressful environment. I would imagine. So that's good to hear.
So Annie, first of all, I would thank you for all the service that you do in the hospital.
Yeah.
You're a great person, and we appreciate everything that you do for us at the hospital, coming from a colleague as well. And thank you for being there today as well.
Thank you so much. Yeah. Thank you so much for coming by. And again, thank you for all the work that is unthanked overall, because I would imagine that's such a selfless job to do. So I really appreciate it.
And that's straight facts.
And that is straight facts, baby.
Yeah.
Thank you. Thank you.